Hello, everyone. Welcome to the VRS Industry Update webinar. My name is Marissa Bracamonte, and I'm the Manager of Education and Membership with the Healthcare Distribution Alliance. HCA's antitrust policy, which we follow for all meetings and gatherings, is shown here. This webinar is for information and educational purposes only. The presentation here is made to inform and stimulate discussion. And I will now introduce Jada Lynn Rand, Director of Industry Relations at HCA, to get the presentation started.
Good morning, everyone, and welcome to our quarterly industry update. We're happy to have this presentation prepared for you today from our VRS provider network. The work and the insights provided today is made possible by our VRS provider network that includes the collaboration of all of these partners seen on the screen. Today's presentation will be led by Elizabeth Waldorf at TraceLink, Herb Wong at Antares Vision Group, Justin Macy from NABP, Rose Campesano from LSpedia, and Adrian Bailey from GS1 US. Welcome to our speakers. Our agenda will follow this format. We'll have first our presentation from our VRS solution providers on the metrics and some education on lightweight messaging. That will go for about 30 minutes. Then we'll hear from Adrian Bailey at GS1 US on an update on GLNs and the data quality initiatives. And then we will take a few minutes to talk about some of our highlights that will be coming up at our traceability meeting for our VRS stakeholders. And then last, we will take questions for about 15 minutes on any of the material you're hearing today. So I'm going to go ahead and turn it over to our VRS solution providers to share their metrics and their report for this VRS quarterly update.
So just want to snapshot the typical, experience we see here, the different codes. We've got the same report that we've provided previously to different groups, but ultimately it's the average response time, right? And we've broken that down by a couple different categories. We'll talk about what those, categories and these codes are you see on the screen in a moment. 200 response codes, just those are always going to be the things that like you're trying to do in VRS, if that makes sense. And then other response codes, that 404 when you don't have a listing that's found, or other error codes. We've got about 6 out of 10 lookup directories that have populated information. That's the most we've had so far. So we're pretty excited to be able to share this information. Herb, did you want to talk about kind of what it takes to populate this information?
Yeah. I think Rose and I can kind of mention a little bit about this one. So I think Justin mentioned this is probably the most we ever had reported, and I think this is if you look across solution providers, depending on how our systems are architected, right, these numbers are easy or not so easy to get, right? And so what you've seen in this effort is a lot of us have come together and just basically start pulling together. But it's more than us pulling together. Some of us are actually making changes to our application so that this is actually a regular report we produce. And this is because of the nature of VRS, right? This is how we know the health of the network, right? Because it's not one system, it's a multiple systems working together. And so, this is something I've not seen in the industry where people actually expose the details of their system. They're making changes to support kind of a broader visibility for an industry. Rose, you want to just kind of add your thoughts in terms of from an LSpedia perspective, what you're seeing? Or maybe not. Okay.
Herb, yeah. I'm going to go off. Hear me okay? Okay.
Yep.
So I am in total agreement with you. It's been an interesting dynamic to see all of the various solution providers come together and work together kind of exposing the underpinnings of what we do and how we do that, so that we can actually come to a good presentation for all of the users of the system, and make sure that we're doing things consistently. It's not an easy task, trying to get different companies to do things in a similar manner. So a credit and kudos to everyone who is providing this information from the user community, but also to across the board to the suppliers, the solution providers who are really attempting to make this a standard for ourselves.
Yeah. And Rose, I'll just add one last comment. I think what the industry doesn't see is before these meetings happen, right? There's a lot of work to pull these numbers together. But the other thing is there is a lot of care taken that we kind of group the data, we make it anonymous, right? And I think Justin was one of the guys who's been pulling this together. And even in the last calls, he's asked, well, should we present this one? Do we highlight someone unfavorably or favorably? So the goal of this is not to politicize this one. This is something we as solution providers do come together, and we're very careful to make sure that to encourage everyone to report, right, we make sure that we report aggregate numbers and not any one specific person.
Right. It's not about penalizing or intimidating anyone. It's really about getting good results across the board.
So before we get started on the metrics, I'm here to kind of give you just a little bit more insight as to when you hear HTTP status code, what does it mean? You heard about the 200, but I'm going to give you a little bit more of that. And what I'm showing is really an excerpt from, Section 9 of the GS1 US LVMS Implementation Guideline Release 1.3.1. So what you want when you're initiating a request is to get 200. That means it's success. That's when you would either get the verified true or verified false. Now, when things go wrong, that's when you see other things. Like 400 means that the parameters that were passed in the request, is incomplete. There's something invalid about it. 403, that's what gets returned if there's, the person requesting the verification doesn't have the, authority. It's not an ATP. That's what you would get 403. A 404 is what would get returned if that G10 is not in the lookup directory. Okay, and then there are other, server-related type of errors. So, for example, the 500s, if verification is getting routed to another service, and that another service is not up and running, or there's something wrong with what gets returned, let's say a certificate type of connectivity issue, then you get a 502. And then another one could be a 503 if there, for some reason, that particular responder server is not available. So this is just like a quick insight, so when you hear these numbers and you see them in the metrics, it'll hopefully give you some understanding of what it means. So now I'm going to turn it over to Justin to walk us through the performance metrics.
Thanks, Elizabeth. And I would say, just to highlight, we kind of break down some of these response codes intentionally to 200s, the thing you wanted happened, 404s, the G10 you're looking for isn't in the lookup directory, and other error codes, because there is some amount of, although they're defined, the implementation can be different across solution providers as well. And I think we'll talk about that later. But yeah, so these are the metrics. We've actually included all of the metrics at the same granular level in the slides as well, if you wanted to look at past months of aggregate data. But this is taken from a 30-day window in June. And so I think the earliest anybody started collecting for the purposes of this report was like 5/28, but everybody has the same kind of a 30-day window intentionally to aggregate this information. On the right-hand side, you'll see a comparison of what the aggregate data was from January, March, and again, this June. And then on the left-hand side here, you kind of see that the 6 LDs that provided metrics to input into this, although they're anonymized. I'll start off by saying one of them's all zeros. And the reason for that is because the way that we report these metrics is always on a requester basis. That's because that's the user experience for someone using VRS from an active request side, not kind of the passive response side. So all of these metrics are going to reflect what someone scanning a product is getting as a process. So we look here at the total numbers of requests. You see the numbers, the aggregate number there of just under 60,000. Then it went up to about just under 120,000, then down to 80,000. I wouldn't read too much into that. I think that is less about I wouldn't read into that as an adoption perspective. I think that's more about seeing the different number of people who have submitted data here, because it's an absolute value and we have different numbers of folks reporting. And I think there's also some noise in there. But overall, I would say it's about what we expect. I'm not seeing a huge amount of difference in traffic. I don't think we're seeing a huge amount of difference in traffic one way or the other right now. But we'll talk about specifics in a bit. You see that cumulative average response time for all requests. That's that performance side of it. You see it's right at 1 second or sub-second, and the average is right around there as well. In the aggregate, that's positive, right? That's what we're looking for the ability for this to operate seamlessly and quickly. And then next, you're going to see the total number of responses that ended up in a 200 error code and the speed of those. You'll notice the speed of those responses are different than the speed of responses you have for average. And there's kind of two different flavors of this that I would suggest that can shift these numbers a little bit one direction or the other. If you have errors that are really fast, or you have responses that are really fast, like a 404 is a really fast response usually. Someone asked to look up a phone number in the lookup directory, or a G10, it didn't exist. Therefore, we respond back and say, hey, it's not there. It doesn't take a lot of processing time. It's very quick. You have an error that's a server timeout of the responding system. That could go there. That could wait seconds waiting for them to respond and come back and fail. So you're going to see a little bit of different average response times there, and they're kind of indicative of the types of errors that may be being seen. So if you come down, so you see that difference there, but ultimately still performance is good. Next, you see kind of that performance total number of responses resulting in a status code that's not 200 or 404. Or in other words, you're seeing, right around there. In other words, you're seeing errors that are error response codes that aren't, the product isn't in the directory, or 200. So this is a scenario where someone is trying to put that G10 into the system and it's failing for one reason or another, or someone's making a bad request and it's failing for one reason or another. You can see that going up a little bit. I think Elizabeth's going to talk about this number in our takeaways. But overall, I would say that that as a percentage of the aggregate is probably the best indicator of kind of, are we seeing problems in the system? If we go down one layer next, you can kind of see the timelines for those. And you can see that average goes way down. That's because it looks like the problems that we're seeing now compared to last month, last time we captured this in March in the aggregate, are primarily system issues that may be on the requester side, where historically in March, it may have been a scenario where there was a timeout or a response issue there that was increasing and inflating that number disproportionately, which is why you'd see those errors kind of increase. So it's a helpful diagnostic tool. We've got some numbers on credentials below that. We can see that one set of data had some credentials. It's the first time those have been populated, but ultimately we're not seeing kind of a dramatic impact in performance here one way or the other that we can tell from these numbers. And then if we go down all the way down here to the bottom, the success rate metrics. So these metrics are explicitly about 200s, or when the requester successfully reached the responder. And you can see that that percentage on the aggregate is holding steady at about 70%. So 7 out of 10 times that someone picks up the phone and tries to call the other person, they get the other person on the other end, and the conversation can happen. When that happens, you can see below that about 94% now. Slight increase, probably not statistically significant is my guess. But you can see a slight increase there of they got back a product code that says this product is verified. The below that 6%, they got back a response that said the product isn't verified. That doesn't mean necessarily that that could be a scenario where there was a problem in the request. Let's say a lot number was mistyped. And then it came back as unverified because the lot or the serial, that would show up there. But I would say that from at least the data that I've seen, you also have a collection of scenarios where the serial number, it's a false false negative. The manufacturer is then reached out to you by the trading partner, and the conversation afterwards happens, and the result is, hey, it actually is good. We just hadn't loaded it into our backend commissioning data from a 3PL or something along those lines. So some lagging amount of time in those instances. We'll definitely take questions on these at the end, so I want to make sure that that there's time for that. But the big kind of helpful thing that's not a big block wall of numbers and stats is this aggregate response code. So like I said before, 7 out of 10 times somebody picks up the phone, gets somebody on the other end. Right now, about 1 out of 10 times, or 9%, that GTIN, that phone number, isn't listed in the lookup directory. It's you go to dial, the other person doesn't have a phone. And 2 out of 10 times, or 1 out of 5 times, you're seeing an error that's a result there. That error could be because of a bad scan, or could be because of a bad response. And then this is that if you got a hold of the right person, what happened? And that 94% of the time, that product's going to come back as verified. 6%, it's coming back as unverified or verified false. Again, that doesn't necessarily mean anything bad is happening, right? Maybe that's the system working. Maybe they're unverified products, and this is effectively going at that rate. My guess would be that 6% of our products that are hitting this scan are not that, and there's some sort of technical issue that's caused a false negative. So we have a little more qualitative data from each of the from some of the providing sources here that kind of break down the different error codes as they're seeing. This can be helpful, and so we can see here with the first one here. These are not aggregated because these are kind of provided as reported. This first one, you can kind of see that other at 10,000, and then if you drop down, you can kind of see a collection of those are 400s. That's a scenario where you're seeing like a lot of bad requests, right? And that's not necessarily impacting any of the other performance or systems or anything like that. That could be a system where the request is going to the requester system. The requester is saying there's some problem here, and it does not pass go. It doesn't continue on. It doesn't impact any of the responders or manufacturers in that instance. It's a scenario that stops kind of at that point. By comparison, if I can look at the 500 codes in the first and last bucket here that are about 3%. Those 500 codes are likely, at least in my experience, are likely timeouts where maybe the responding system's taking a little bit too long, and the requester system says, hey, we're done waiting. A 500, the other person's system is down possibly. That's at least what I've seen. And then if you look at the 502s in the second column there, that number, that's going to be a scenario where the response possibly didn't come back in a way that the requesting system could recognize, or that there was some other gateway error that occurred prior to it. And so that's an example where contact information may not have been there, and the responding system, the requester system, when it got the response back, said, hey, I can't read this JSON format because it doesn't exist the same way, or there's an error code that isn't necessarily written in a way that it's set to interpret. So that can be kind of the case there. I think in this ballpark for these numbers, we also saw scenarios where there could have been certificate issues, not in the ATP sense, but in the communication layer between solution providers that triggered errors and caused things like this. So overall, from what we've talked about amongst our group in kind of pulling this data together and the different things that attributed to the error rates that we're seeing, we would definitely say request quality, which we've already talked about, system timeouts, that solution provider connectivity certificate issue. That's a matter of all of us coordinating on our end to make sure that we all have the security certificates to connect. We've seen some solution provider transition coordination issues. Let's say a responder is using solution provider A, they move to solution provider B. The coordination of that from one to the other can lead to issues here and there. And then I'll also talk about controller possession flags and regulator requests. That's something we specifically see, and we'll have metrics about regulator requests, I think, on the next slide after this in a second. But ultimately, I think that there's a gap in that people didn't really anticipate the system being used for regulators originally, and there's a controller possession attestation question. When those are responded to by regulators, the requirement of them having controller possession to make a request isn't there the same way it is for trading partners. And in some configurations or systems on the back end of responders haven't been set up to respond to a regulator making a request saying controller possession false, because they're designed for the trading partner use case. So I think there's still some learnings that we're trying to figure out there, and some alternative solution that we're trying to work around in those instances. And lastly, we've already talked about the false negatives. Again, I think that there are definitely possibilities for false negatives when a requester sends a bad scan. I think that the majority of those, at least those that I've dug into kind of in the small data sense, have been scenarios where we've heard that there wasn't an issue with the scan and there was an issue in the responder system. Sometimes the idea of like whether the 3PL had populated the information to the manufacturer's VRS responding system or things like that have occurred. Grab the next slide. And this is the metrics for regulators. So right now, and I'll speak to this from our end, these folks are using us in this instance. We've got 27 states utilizing it. That may be the DEA field office in a state, or it may be the Board of Pharmacy, or the board that regulates the wholesaler in that instance. We had, during this period, a little over 1,000 requests made by regulators. This is an upward trend we saw in the month prior to, and that's about 100-fold increase from before that month. So the last time we reported this, I think we had 12. So pretty substantial increase in the number of requests being generated by regulators. I'll also show below there that almost all of these requests are being made. In this case, for this month, all of them were as a status check and not a suspect product investigation. And that part of that is definitely that regulators appreciate that when a request is made that it says suspect product investigation, that the responder is going to do a bunch of other things. And that isn't the intent with some of these scans. And that's kind of the guiding principle. So we've really trained and indexed on the default being, unless you are doing a suspect product investigation and you want that outreach from the manufacturer and you want to kind of kick off that chain of events, to being that status check. And doing a status check doesn't mean you can't come back later on and do a suspect product investigation as well. You can always escalate it. And with that, I think that's, yep. And I'll pass to Elizabeth for takeaways.
So, now that, Justin walked you through the metrics and drilled into some of the findings, now I'm just going to pull us back kind of like in looking broadly, what did we learn from collecting this metrics? So, as presented, we've done this presentation on metrics about 3 times. So we are still establishing that baseline, even though we've done it 3 times. A lot of these things have been highly manual. We're working towards getting that more automated in each of our respective systems. And, so it's from getting that operationally better and more efficient, and as well as making sure as we are getting more and more solution providers to collect and report on the metrics, we have to align on each of the metrics and what it means, and making sure that they are really comparable. So that's part of what we're, experiencing right now. It's establishing that baseline. Now, from a performance, as you saw, and Justin walked you through it, that there is really no concern. We are still in that sub-second range. You did see that there's instances where HTTP or the error codes have been misclassified. And we also observed that some of the metrics have been skewed, meaning that, there's some of the numbers are higher in terms of errors and so forth. For example, verification of the G10 is not found because, upon looking at the data, we are finding that there's been some customers performing testing in our production system. And by testing, that means that they are using products, scanning products, or entering products that are not really, valid products. So some instances of, for example, a G10 that has the value of tests and a lot number of tests. So obviously these are not truly true products. And Also, we are still finding that, contact information is not there. And, that is a requirement that's been put in place and articulated as something that's important for both the requester and responder. And so when there's no contact information, it cannot be processed. So what do we do? Given that we are stabilizing the collection of the metrics, we are leveraging this regular cadence because as we are doing it about on a quarterly basis, we are now not only integrating that to our operational processes, but we're now able to look at trends, identify variances so that we can take action. And it is in looking at the data that we then look at each other and say, hey, what can we do operationally, each of us, to make it better? What can we do to help each other? And overall, how can we help the industry? So I think it's good overall. Now, from a customer engagement, we, as I mentioned, we did find testing happening in production. So this gives us an opportunity to reach out to our respective customer and find out how are they using it? Why is it being done that way? And then with the contact information, each of us, could be reaching out to our customer base and say, it's been configured, you can put in contact information, can you help us? Please populate it. And then from the error message, we talked about that there's been some misclassification of the status codes. And we see improvement in which, let's make sure we're classifying the right errors the right way. Let's improve also the message that comes back. So that way it's more actionable for the customers. And with that, we would need to have planned software updates to make this improvement. So it is, if there's anything that we are going to take away, it is a continuous process improvement for all of us. Next slide. I think we, now I wanted to shift back to just say, I know it's, we've been talking about the VRS and the features that we have, and I'm just going to do a little bit of a refresh because as I mentioned, there are still some information that's not coming through, so bad scans. So one of the big things that I wanted to share is that we actually just had about 2-year anniversary of the latest release, right? So July 10th, 2023 is when we cut over. We together in that synchronized mode cut over to the latest version that aligns us to the GS1 US lightweight messaging standard release 1.3.1. And this is when we began to expand the capability beyond sellable returns to enable, right, the checks, verification checks for suspect or illegitimate product, for exception processing and status check, right? And this is where, Justin talked about the possession or control attestation variable that we came in. And we also expanded the use cases. So now it also is able to track extended expiration and return that, for example, in the additional information. And, highlighted here is the contact information because we, the industry has told us is very key, right? So when a responder gets a request, they would like to know who to follow up with. And so that would be the requester contact information. And then when it comes back, there's contact information going back to the requester so that we are able to put together the parties involved in the verification. Because as you know, it's not direct trading partners only, that's making the request. It's the indirect trading partners, and contact information is very important. And as part of the implementation, one of the things is now we've also self-identified it to say, hey, which standard are we aligning towards? And that's the GS1 US version. And finally, there are in the additional information options to say, hey, this is in addition to returning true or false. You could say, well, this is expired or recalled. And in those situations, if for some reason a particular product identifier is both recalled and expired, in the implementation guideline, we are given, what's the priority of the message that we should return. So, for example, in that situation, we would say recalled would be a higher priority message. So if a verification product identifier is both recalled or expired, you would see in the additional information recalled. So anyways, it's just a quick refresher, but again, this is a request for the industry. Please make sure you're entering the contact information to make sure that verification requests can go through and that enough information can be provided so that the communication can occur. And with that, I turn it back to you, Jadalyn.
Thank you all so much. Great presentation from our solution providers. For the next 10 to 15 minutes, we're going to turn it over to GS1 US and hear from Adrian about the data quality initiatives.
Thank you, Jadalyn.
You're welcome.
Okay, I think this is my first HDA webinar. I've been attending HDA conferences in the past and actually hosted some roundtables in the past. So thank you for allowing me in your presence today. And I'll take the next 10 to 15 minutes to discuss GS1's initiative around GLNs and the data quality work that we've been doing over the last year and a half. Just starting out with who I am and who we are as an organization. My primary focus is supporting the healthcare industry and adopting and implementing GS1 standards to support supply chain visibility and efficiencies. I've been with the organization for about 14 years, 8 years in healthcare for GS1. Prior to coming to GS1, my field of study is nursing, and I also worked in retail pharmacy as well as inpatient hospital pharmacy, one for Walgreens and also a local hospital network in the Dayton, Ohio area. GS1, just to give you an understanding of who we are as an organization, for those that are not familiar, we're a neutral not-for-profit standards organization. We are primarily here to develop standards, supply chain standards, to create a common language for products and locations across various sectors, including healthcare. We are user-driven. We operate multiple industry forums for collaboration, similar to HDA. We also have industry-specific work groups that work on a lot of these initiatives. We are global and local. We operate in over 110 countries. And again, our primary objective is to enable companies to speak the same language and connect with one another. The next slide. Thank you. So as I mentioned, I'm here to talk about GLNs and what we're doing around data quality. So global location numbers have increased in use for the purpose of traceability. One of the initiatives that actually increased the usage or adoption of GLNs is the DSCSA. And the global location number, for those that are not familiar, it's a 13-digit number. It's used to identify primary locations, legal entities, different functions within your facilities or operational entities. The global location number is also used in the verification router service. It uniquely identifies locations and parties involved in supply chain transactions. Also used in other areas such as EPCIS and EDI transactions as well. So GS1, given the history that I just provided of GS1, one of our primary focuses is to not only support the adoption and implementation, but also maintain the data quality of our standards, one being the location data. With that, we have specific industry forums dedicated to users who are users of our Data Hub location tool. It's a tool that GS1 provides as a service to our members to create and manage and share location data. Within that group, we have a group that is dedicated to the users, and some of the industry feedback that has been coming back around the use of that data, mainly some of the errors that they may be seeing in the data, duplicate GLNs, the fact that they are unable to kind of search or see or utilize some of their trading partners' data because it may not be shared within that tool, within the Data Hub tool, so they can't can't access it. So with that, we took the initiative as a team, a healthcare team, to come up with a GLN data quality strategy focused on a subset of our data hub users. I'll go into who those users are in just a moment, but just to set the stage of what this project is, and I'll go into how effective we were maintaining or cleaning up some of this data. Our primary objectives for this group we put together, and it's an industry-focused group. It was to encourage healthcare organizations, one, to share GLN data. Some of the data was either not in Data Hub location to begin with. They may be just maintaining GLNs on their own systems. And we would like, for industry would like to have those GLNs present in Data Hub as a primary source of truth for GLNs. Then there was also the other end of the spectrum where the GLNs were there in Data Hub, but they were not in a shared status. So if you were going to search for some of these GLNs for your trading partners, they say that they exist, but you could not see those. We also had an initiative within this data quality group to focus on large retail pharmacies to share GLNs in Data Hub. So we had an outbound campaign where we reached out to these large retail pharmacies asking that they transition their data into Data Hub. The other objective of the group was to clean up the duplicates. So there was a large number of duplicates that was discovered within the tool, and we had a group that primarily focused on looking at those duplicates, identifying which GLN is primary, and then which GLN was the duplicate and that be removed, so that the ease of use for those who were coming in and searching the data, understanding which GLN to adopt into their system could get easier. And then lastly, we initiated some activity around improving the technology. So the next slide, I'll go into just who actually supported this work, which was our managed GLN program subscribers. I have a list of those here, but this data quality effort was facilitated by GS1. And we kicked this group off in January of 2024, actually. So we've been working for about 1.5 years. And these parties came together as they are primarily the parties who initiated GLN data on the behalf of our of pharmacies or small hospital entities. So this group of stakeholders came together. They initiated the GLN data for those small pharmacies, independent pharmacies as well. And what we've also found is that some of that data, because it was not initiated by the owning party of that location, and it was essentially initiated by a third party, which was either their wholesaler or GPO, the data could, utilize some additional attention and cleansing. So what we did with these stakeholders, if we can move to the next slide, what we did was we took a look at just the universe of, I'm sorry, the next slide is, we took a look at the universe of who owned the majority of the GLNs in Data Hub. And taking a look at this slide, as you can see, there's about 1.4 million healthcare GLNs in Data Hub today. Of that 1.4 million healthcare GLNs, there were about 45% of those healthcare GLNs are managed by the stakeholders I just reviewed, the GPOs as well as the wholesalers. So with that, we initiated and kicked off, if we go to the next slide, just to review just our timeline of our project. As I mentioned, we've been meeting for 1.5 years. So this project initiated with a couple different phases. We had 3 phases with this. We started with encouraging the sharing of the GLNs and getting the data into Data Hub, as well as that data shared in Data Hub. Second phase consisted of just the partners coming together to take a look at the duplicates within Data Hub, across all of the managed program subscribers. So we had the GPOs and wholesalers working together to take a look at who they enumerated, if there was a duplicate, which GLN should survive, which GLN should go inactive, and which GLN should be adopted into systems going forward. The third phase of this work consisted of a second pass at the duplicate cleanup, as well as some of the GPOs came together to focus on primarily the health systems that they manage but may not have a pharmacy associated with it. So they may manage locations within a healthcare system that consist of different functions or different areas of that hospital. And then we also, again, with all this work, we did focus on updating systems. We were able to publish some best practice guides for industry, some additional features and enhancements to Data Hub actually came out of this work, which I will review at the end. But in the next slide, I just want to just go over the results of the work that we initiated with this group. So this is a bit of an eye chart, but I'll go over each quadrant within this slide, starting with the top left, where we identify the potential active duplicates in Data Hub. And these potential active duplicates is across Data Hub's universe. So we have multiple industries within Data Hub that could possibly create duplicates. So this, where we started when we initiated this work back in January 24, there were over 300,000 potential duplicates, and that was just potential. We did have to do some additional analysis to understand if they were true duplicates. As we've done that, as you can see here, year over year, we've decreased this about 45%. We're seeing significant improvements in the number of potential duplicates coming back through our analytics system. And we're continuously working with these systems to work through this on a continuous basis. So the group will conclude at the end of the year, but we have a means that will allow these participants to continuously monitor the data for duplicates and unshared data. Moving over to the right top hand quadrant, this is just an idea of the universe of users within that managed sphere. So they're managing 45% of the GLNs in Data Hub. It consists of about 11 managed GLN program subscribers. So there are about 5 wholesale distributors and 5 GPOs, or 6 GPOs. And then there are about 315 self-managed users. These are hospital systems who have gone to their either wholesaler or GPO and express their desire to manage their own GLN data in Data Hub. So they've taken over the management of their hierarchy. They're going in, making corrections, and as hospital systems adopt Data Hub and manage their own data, we see the data get better when it's user managed or owner managed. Just going down just to the bottom right-hand corner, here are the active managed GLNs in Data Hub. So these are the GLNs that were found in Data Hub that were managed by these 11 subscribers, and they're active, how many GLNs that were active. We were looking for this number to decrease as they go through and do the cleansing and inactivate duplicates. We're looking for the active GLNs to decrease, the inactives to increase. And we've seen a significant difference in or improvement in that year over year, 30% decrease in the active and about 348% overall decrease or increase in the inactive. And just to give you a little bit more context around that, we've deactivated about 197,000 GLNs over this year and a half that we've been working on this project. And with that, we also, if you go to the right hand, over to the right a little bit under the unshared, there were about 100,000 unshared healthcare GLNs in the system prior to this work being initiated. With that, we've been able to decrease that quite a bit over this time period through those active campaigns and reaching out to these users. to share that data. So that's just an understanding of the outcomes of the work that we've initiated with this group. I'll go to the next slide just to talk about, lastly, how we've improved the data hub. So GS1 operates a data hub location platform. And this tool is used to help drive reliable location data, but also help to users to create and manage their data. The benefits is increasing accuracy, it supports traceability, and we have initiated a couple feature requests as a result of this group, one being improving the API functionality of Data Hub location. So you'll see some additional feature opportunities or options within the API around the search, as well as introducing a bulk search. This is a feature that will come later this year, but this bulk search will allow you to actually use the GUI to do bulk searches by addresses or GLNs. And then initially, as I mentioned before, we do have some additional training and that has been born out of this work. We've updated some of our user guidance documents as well. And this is my contact information if you guys have any questions, but I look forward to the Q&A at the end. Thank you.
Thank you, Adrian. I appreciate that timely presentation. So moving forward, how do we come together and how do we get to this presentation? A lot of what we talked about today, everything that we talked about today, comes from the advisory of our stakeholders who participate in the VRS Provider Network stakeholder meetings. The entire set of metrics that was presented to you has been the effort of that group coming together and talking about their user experience and what they would like to see from the solution providers in terms of reporting out on the performance and the metrics that were gathered and shared today. Having Adrian here, who graciously agreed to come on today and share this data, was at the request of our stakeholders wanting to know what was going on with GLNs, how it relates to the functionality and usability of the VRS solution. So just grateful for the opportunity to collaborate with both the solution providers, those who are setting industry standards, and hearing from the users of VRS as those stakeholders who have been giving us insights on their experience and how it can be improved has been incredibly beneficial. So carrying on in that same way, we will be hosting our annual traceability seminar at in the first week of August. At that meeting, we will be coming together for a lunch meeting at Traceability with our VRS stakeholder group on Wednesday, August 6th, 12:30 p.m. to 2 p.m. If you have not registered, please follow the link below. If you have not gotten the invite to that stakeholder meeting, please reach out to myself, Jadalyn Rand at HDA.org for any questions on how you can be a part of the stakeholder group and help continue to guide the efforts that we put forth in these presentations to share how this solution is coming along and aiding the industry in DSCSA compliance. So after what, I won't delay us because we don't have much time. So let's go, and I'm going to stop sharing the presentation at this time and turn it over to Q&A. All right. I know we did get some Q&A in the chat, but I'm going to go over, let's see. If you all have any questions, please go ahead and drop them in the Q&A now, not in the chat function. I don't know if we have the capability of raising hands, but if you would like to raise your hand, let's see. All right. it appears that we were very detailed and we got all the questions answered that you all have on your minds, which is always great. If you all have any questions offline, please reach out to myself or Tim, or any member of the HDA team can direct you to who can answer your questions and how to get back to this group. This was our recorded webinar. So this will be available on HDA website under the VRS provider network. So you will have opportunity to review this presentation and its slides at a later date. If you have any questions, again, please feel free to contact us here at HDA. I don't see any questions, so thank you all for attending. It is Friday. I hope you all enjoy your weekend. Stay warm. If you're getting a ton of rain, stay dry. Marissa, do we have any closing housekeeping comments?
No, Jada Lynn, I think you covered it. Thank you very much. And thank you to our speakers and our attendees for joining us on this webinar. Just one final reminder, the 2025 HDA Traceability Seminar will be taking place August 4th through 6th in Washington, D.C. Have a great rest of your day, everyone.